My name is Dr. Shahzaib Ashar. I'm a general practitioner in Pakistan and I'm currently working at DHE Hospital. Okay. I would like to thank California Institute of Research and Technology and my mentor, Dr. Bernie, to give me this opportunity to present myself. I mean, it's really great. I'm really thankful for that. Okay, so today I'm going to talk about an atypical presentation of the coarctation of the aorta, and it's a very rare case. You may not be able to see it in the hospitals. It's very rare. So let's begin. We have this patient who is 18 years old. He presented in the ER with the headache and epistaxis that was there for 1 day. When he came with the nasal bleed, it was there for like for like 10 minutes, and he has this persistent headache which was not relieved. When we saw that, nasal bleed, there was we took the further history, and there was no signs of any blurred vision, or there was no vertigo or any signs of dizziness. There was no generalized weakness in the body. So we managed this nasal bleed with a lot of compression, and once the patient was relieved, we further took the history, and he claimed that he has hypertension that was there for last 2 years, and he was non-compliant to his medication. He never took any medication. I mean, on and off he was taking, but it was never really on point. So we further asked the patient that how did it happen actually, and he said that he has this headache which was not relieved for the last 1 day, and he presented in the ER. So we checked his vitals. It was absolutely okay. His pulse was normal. It was 95, and his temperature, there was no when we checked his temperature, there was no temperature. And when we checked his blood pressure, his systolic blood pressure was 180, and his diastolic was 100. It was 100. It was remarkable because I was not thinking that person with a nasal bleed could come up with this. And his so once his we saw that he has high blood pressure, we checked we checked his jugular venous pressure or any signs of carotid root. Okay, so once we saw that his BP was higher, we also checked his radial delay and radiofemoral delay, which was positive, which made me, start my examination, and we went for the CVS examination. I placed my I placed my stethoscope on his chest, and I heard a murmur, loud systolic murmur, which was present in the fifth intercostal space, just posterior to the chest wall along the medial side of the scapula. Once I heard that, we run the labs. We did his complete blood count. We run the liver function test. We did the ECG. It was absolutely normal. It was absolutely normal. So it was like a shock for me, like if what is going on. We did the echocardiogram, because since his blood pressure was on a higher side, so it made me think that I must go for the echo. And when we did the echocardiogram, we found that there is coarctation of the aorta distal to the origin of the subclavian artery. To confirm our diagnosis, we did the CT aortogram, and it also showed the narrowing of the narrowing of the aorta distal to origin of the subclavian artery. We done the other tests such as thyroid function test. We did check the bleeding and the clotting time, which was normal. And so at last we did the fundoscopy, and we found that there is grade 2 hypertensive retinopathy. Okay. So now let's move on to the treatment, because it is established that now he has the coarctation of the aorta. We had to manage it with the beta blockers and ACE inhibitors, angiotensin converting enzyme inhibitors. And once we managed the patient, we stabilized the patient, we immediately referred the patient to the cardiothoracic surgeon for the further management. Okay. And when he was referred to the cardiothoracic surgeon, he underwent balloon angioplasty, and the stunting was done, which relieved the narrowing of the narrowing of the aorta. Later on, he was advised about his lifestyle modification and his diet, so that his blood pressure may improve. Now, one thing that I want to discuss, one thing that I really want to discuss about my case is that he's really young. And, anyone who comes with the nasal bleed, you might think that it could be a nasal polyp, it could be adenitis, or it could be due to summer, or, it could be a foreign body, or, it could be a trauma, or it could be a nasal septal defect. But there was no such thing. The only clue that I had when I saw the patient, that was hypertension. That was the only one clue. So any patient who comes, any patient who is young, who comes for the treatment, who comes for the management, should not, should not be missed, especially with the hypertension, because a lot of because being a general practitioner, if that same patient would come in the ER, I would just simply check his vitals, and I may or may not, check his chest to hear the heart sounds, because if I've missed my heart sounds, I may not be able to catch the murmur. That was the only clue for me when I catch that murmur. So, you should always rule out acute glomerulonephritis, or it could be a renal cell carcinoma, or it could be, pheochromocytoma, any cancer, or it could be, it could be Takayasu arthritis, or it could be thyrotoxicosis. Initially, one may think that since he is coming up with the hypertension, so you might be thinking that this is thyrotoxicosis, because it is very obvious in thyrotoxicosis that the patient may have this hypertension, right? But you should never miss it. And you should guide the patient once the patient is being treated. You can guide the patient about the lifestyle modification, and you should aware. You can set up medical camps, and for there you can set up medical camps for general physical examination to check the blood pressure and blood sugar levels, and that should be measured to the general population. And it should, you should create awareness among the people that any such patient, again I'm repeating it, that any such patient who would come with a hypertension should not be missed at any cost. I would like to thank again California Institute of Research and Technology to give me this great opportunity to present my case. It's really an honor. It's really an honor, and especially Dr. Bernie to give me this huge opportunity and guide me throughout, because without his guidance, I couldn't have just done it well. Thank you so much, and I'm grateful. Thank you.